Hi, my name's Jason Clark. I'm the marketing manager with Valent Biosciences Corporation, and we're here in Key West interviewing staff with the Florida Keys Mosquito Control Program, developing a visual SOP for their container mosquitoes. And I'm here with Patty Sprague. Hi, Patty. Hi, nice to meet you.
Nice to meet you.
And so Patty, can you just kind of walk us through what some of your responsibilities are as a field supervisor?
Well, I have a certain location that I come and visit every month. What we do is we go house to house and I look at all containers, pools, garbage cans. We're at the cemetery, so I come to the cemetery and I look at the vases, anything that can hold water.
Okay. Now, my understanding was that this was the epicenter back in 2009, 2010, when there was the first locally acquired cases in 75 years here in Florida. Could you walk us through a little bit of how the Florida Keys started doing their surveillance and started tracking, an understanding of where the source of the Aedes aegypti were coming from?
Well, back then, we had less inspectors. I think there was only 4 at that time. And in this cemetery, there's over 4,000 vases and containers to hold water. Since the dengue epidemic happened, they added 6 more field techs.
Okay.
So that helps with the going every, trying to visit every site. We changed up some of our products, and we just started to go to the places more often.
Okay.
That really helped. Our numbers are down tremendously from what they used to be.
Okay. So in a cemetery like this, you said that there was about 4,000 containers or places where the mosquitoes could hang out. So how often do you come to a place like this to make sure that, is there water? If there is water, are there larvae? Do we treat? How often do you come in and out of a place like this?
Well, it all depends on the season. Our rainy season, I come like once every 2 weeks.
Okay.
I do have longer-term product in here. During off-season, I come once a month.
Okay.
But when it rains, because the garbage cans are open, I have to check them every time it rains.
Okay. Now, are there other leaf litter and other stuff around here that you treat, or it's just primarily containers, or how do you?
Well, if we have standing water, I also treat the standing water.
Okay.
Because mosquitoes, they can pop off on anything. So.
Okay. Okay, great. All right, well, let's go explore a little bit, and then we'll take a look at some of these habitats and containers and exactly how we go about treating that. So,
okay.
All right, great. So, Patty, when you're coming to a cemetery and you're looking to treat for mosquito larvae, how do you handle kind of respecting the flowers and the vases that people bring to the gravesite, but at the same time still manage public health and the ability to treat containers?
Like I said earlier, I have 4,000 containers. I'd rather not have them turned over because people do come and they turn them back upright to put flowers, real or fake, in. And so when I meet somebody or when I'm talking to somebody, they show their concerns that there are so many vases, but I assure them that there are treatments in all the vases.
Okay.
And it's like hide and seek. Every day I play hide and seek. I look for the water, I treat the water, and hopefully there are no larvae. Yeah. There is nothing to worry about.
Okay, great.
So a lot of my job consists of going house to house.
Okay.
This is an example of a cistern that they turned into a pool.
Okay.
In my area, I have over 300 cisterns and 200 wells. Back in the day, that was their source of water.
Okay.
So as you see, this is deep. Usually they're 8 feet by 10 feet. So, and a lot of times I have to crawl underneath houses to access them.
Okay.
They still have water. They're a great breeding site for the Aedes.
So how do these cisterns that are outside or underneath the home, how do they all collect water? Is that just rain driven through the gutters, or how do they fill up with water?
Well, there's two different ways.
Okay.
The gutter system is the main source, but there's also the groundwater.
Okay.
So as the tides rise, we do have a system at the water table.
Okay.
So a lot of places that you think would not have any water do have water, and hence a good breeding ground for mosquitoes.
Sure, sure. And does everybody know they have a cistern, or are there some people who don't even know, just because the system's so old, you know, not everybody would know. Is that the case?
No, actually, there's a lot of people that didn't know that they had.
Didn't know, okay.
Yeah, and I've gone under houses and told them that they had cisterns and wells.
Okay.
And I've treated them.
Okay.
And then I've told the landlord or the homeowner.
Sure.
And they're like, oh, is that why we have this cutout in the middle of the living room, like a trap door? They had no idea, but
okay.
that was how they accessed it back in the day.
Was from inside the house?
Yep.
Okay.
Yep.
Okay, interesting.
Yeah, it's actually kind of fun to tell the homeowners that they have a cistern. Most of them had no idea.
Okay. Now, when treating the cisterns and treating a lot of these habitats in residential areas, how do you mark that a given cistern was treated or a given house was treated? You guys have some GPS mapping where you just say, I've treated this house and this house and this house?
Well, we do it two different ways. We actually have a new system, but our VCMS, everything that we treat, we write down.
Okay.
So that there is a written record
Of just the house?
of just what we did at that house.
At that house, okay.
Yep.
Okay.
So I can go back and look and see what I've done 5 years ago at that house.
Right.
And what is at that site.
Sure.
You know, if there's a bucket, if there's a cistern, if there's a well,
Okay.
if there's a bottle cap,
Right.
I write it all down.
And so since 2009, 2010, when the domestic program was really beginning to ramp up,
Right.
I'm sure the data on each of the residential homes now has also increased in terms of knowing exactly what's at a given house and property.
Oh, definitely.
Okay.
Having more inspectors, we can get to the sites better than what we used to.
Right. You're not trying to get to as many sites as possible. You can have more quality at a given residential
Exactly.
site.
Yes.
With multiple people.
Yes.
And so, okay.
And
interesting.
then, you know, a few years ago, it was a lot of requests. A lot of if somebody calls in, then we go to that site and
Okay.
we look around and see what we can find. So having only 4 people in Key West,
Right.
they were doing a lot of requests.
Okay.
Because the mosquito control was, you know, not as big as it is now.
Now, as part of what you do, kind of survey-based and qualitative, where you'll go up to the homeowner and ask them, have you had problems with mosquitoes? Have you know, is all the work that you guys doing, is it working? I mean, you guys can set adult traps and you know, test for larvae in the water, but there's just kind of a qualitative, are you getting bit by mosquitoes? You know, that type of thing. Do you do a lot of that as part of the domestic program?
Yes, I can't stress enough. Talking to your homeowners and finding out and having them feel confident to call if they are having a problem.
Okay.
That is probably our biggest job, is to hand in hand with the homeowners,
Okay.
because they are there every single day.
Right,
They know
right.
when they're getting bitten.
Exactly.
You know, as much as we try and be there,
Right.
we can't be every place. So having
Right.
them call in, you know, talking to them about what their mosquito problems are or if they've seen any,
Sure.
that is so helpful for us.
Okay, okay. Now, do you have like pamphlets or brochures and stuff you leave behind and kind of thank you for letting us protect your health and stuff like that?
Well, we have these pamphlets. In fact, I have one with me.
Okay, sure.
I always carry it with me. And we have actually a couple of them. One of them describes dengue.
Okay,
This one is just an inspection form.
okay,
I like this one because I can write on it. And it just says if we could access their property, if they have a mosquito problem, if we haven't been able to access their property, they have all the phone numbers on it.
perfect.
And it's great because I can leave them notes, you know,
Right.
tell them what's going on.
And then they try and put the same inspector to the same locations to build that relationship, I'm assuming, as versus switching people out.
No, we have our areas.
Okay.
But about yearly, we like to switch areas so
Okay.
that everybody knows each other's areas.
Okay.
So if there's ever a problem,
Okay.
you know, we're not going into an area we've never been before.
Right.
So we can kind of know what's going on. But also with with all of our data, we can actually look and see, okay, like a lot of people would not know to look under a house for a cistern.
That's right.
So if they come to my area, they'll be able to see that there's a cistern
Right.
and it's under the house. So
Okay.
it's a lot of cross-training, which is, invaluable.
Okay. Now, do you feel like the 6 inspectors, that seems to be enough to kind of manage Key West, or you have to manage multiple areas of the Keys?
Well, we go from Key West to Key Largo.
Okay.
Yeah, so
Okay.
we have 70 people working. Not
okay.
all inspectors, but there's about 70 people.
Okay.
And yeah, I mean, it would be, my area is about, it takes me about a month and a half, 2 months to get through my area.
Okay.
And they would like to have it at a month. So if we had another inspector, maybe we could do it month to month.
Okay.
We're maintaining now, but if
Right.
something happens, and I know they're trying to get other inspectors just to make sure nothing happens.
Right,
We'd
exactly.
rather be proactive
That's right.
than reactive.
That's exactly right.
Yeah.
Yeah, because when you're successful, nothing happens.
Right, exactly.
Yeah, exactly.
So-
Okay, great. Thanks.
Yeah.